Treatment for HIV has improved greatly over the years, but Mississippi still has one of the highest rates of infection in the country.
And despite advances in testing and treatment, we also have one of the highest rates of AIDS, the deadly disease caused by HIV.
WJTV's Natay Holmes visited a local group hoping to change that through new forms of treatment and education.
Open Arms Health Clinic in Jackson treats both people who are infected and people at risk of getting the infection. A new tool in their arsenal is an effective drug that not many people may know about.
It was my 27th birthday, and I was like, you know what, I'm gonna start going back, getting tested regularly, and got tested, and that day I found out that I was HIV positive.
Marcus McPherson has been living with HIV for the past 5 years. He tells me he was diagnosed while attending grad school.
At first, I kind of didn't process it. Immediately after I got my results, I left out, went to class, and it really wasn't until about a day or so later that it really hit me that I was HIV positive, that I had been diagnosed, and that my whole life was basically gonna change.
And Marcus's story is not unique here in Mississippi. According to the CDC, Mississippi has the 9th highest rate of HIV infection in the country, and Jackson is even higher.
As a city, Jackson has the 5th highest rates and diagnosis rates, and the highest AIDS diagnosis rates. And what it means is that in Jackson, when people is diagnosed with HIV, we have the highest proportion of people who get diagnosed so late in their infection, in their disease, that they actually get diagnosed with AIDS.
Jackson specifically, 4 in 10 gay and bisexual men in Jackson, Mississippi are HIV positive. Now, that's not the scare message, that's the stat message. The solution is testing. The solution is prevention and care.
Since being diagnosed, McPherson has been working with My Brother's Keeper, a nonprofit with the mission of reducing disparities in medical care.
We realized that a lot of the people that we were serving weren't able to get quality care. Open Arms was an extension of that mission in order to provide something that our communities did not have access to before.
Open Arms was the first clinic in the state to prescribe a medication called PrEP. Approved by the FDA in 2012, it has proven to be effective.
It can reduce the risk of HIV by more than 92% if taken every day.
The likelihood of you reducing your exposure has never been higher than with PrEP. It's a complete game changer.
Joshua Agee says he started taking the drug when he moved to Jackson, and like many, had anxiety about being tested.
I was totally freaked out about getting tested. One of my friends invited me to an event, and some guys there invited me to Open Arms Healthcare Center to be tested, and I came. My test was negative, and the doctor came and spoke to me. The doctor said if you're sexually active and you feel you might be at risk for HIV, you should strongly consider taking Truvada as PrEP.
Dr. Mena says the drug is not as popular as it should be because many physicians still don't know about it.
1/3 of healthcare providers still did not know what PrEP was. HIV specialists, who are the ones who typically manage HIV drugs, typically don't see people who are HIV negative.
The drug is covered under most health insurances, including Medicare and Medicaid. Those that deal with HIV and AIDS every day say while the drug is an important advance, getting tested is just as important.
You don't know if you are transmitting the virus if you don't know you're positive. You don't know how to take care of yourself if you're positive.
There is also a patient assistance program for those interested in the PrEP drug who may not have health insurance. Open Arms Health Clinic offers counseling sessions with patients who are HIV positive and those that find out they're not infected, but might be able to learn more about making healthy choices going forward. Natay Holmes, WJTV 12.